Morpheus is radio frequency microneedling, and as you can see, this is a new technology that actually works very nice for both skin tightening and also superficial fat removal. And the beauty of this is that it can be done in the office. And we've now done this. This will be the third treatment, and David has done her abdomen spaced 6 weeks apart, and it is pretty amazing on the results that we're seeing. And we're actually doing the first IRB approved study on this coming up soon. And we use Pronox, and we use topical, and you can see this is the third pass on this, and it works beautifully. David, tell us about your experience with this.
Yeah, so morpheus8 radio frequency skin tightening is a great treatment for anyone who has any sort of superficial skin laxity that doesn't necessarily want to go under the knife or have surgery. We do a series of 3 to 5 treatments, and we'll continue to treat you until we get the skin as tight as possible and get you the results that you want.
Good. I think it's new technology that is going to be very, very powerful, not only for the abdomen, but also for the face and other areas.
Go.
I'm with Kaylee today, and she's about a year after her face and eyes, and she had a little slight fullness post-op. And so what we've done using a new technology in this area, we've actually done 2 Morpheus, which is radio frequency microneedling, and they're Teflon coated, and they go to the depth in the dermis so that they spare the skin, and they go down and shrink the dermis and also remove a little fat. So here she is after 2 treatments. That's pretty impressive, and we're going to do the 3rd treatment today. So here's her before, and here she is after 2 treatments. And so what we're going to do is see if you can focus in on these micro needles. So these actually, they're very focused, and they're Teflon coated. And so what you do is you stack them, and in this case we're using this at 35 cycles, 35 energy, and we will begin by doing it in this area. So we just and what we'll do is and we've numbed her up for about 30 minutes. Just put your head up, and so we're just going to just soften this area, and it's amazing. We'll stack it, and what we've found is that this works pretty amazingly well, especially in this type of patient and also in the younger patient. Ooh, sorry. And then so we come back, and how are you doing?
So far so good.
Okay, good. So this is a sequence. Okay, some of the key safety points of radio frequency bodytite is obviously maintaining contact with the skin, and also deep, so you get the proper temperature differential and know when to stop. And also, we're doing this in quadrants, and of course we have a lubricant externally, and it's got a super wet internally. Erez, what else do you do that actually makes it safe?
Well, I think as Dr. Rourke mentioned, keeping contact is important because this is a bipolar device. The other portion about it is when you reach the entry point, you want to make sure not to hit that point too many times, as you can accumulate too much heat there. And otherwise, just patience and being gradual.
And you can hear that slow pulse, and as it gets faster, then like right there, that means we're getting close. And notice he's actually putting a little pressure externally to make sure this stays in contact continually. And tell us about the different other noises that you hear that are reflective of safety.